African Football Tournament in Morocco this December.
Alan Okello!
Subscribe for 1 month and get an upgrade to the next bouquet. If you subscribe for 3 months, you automatically enjoy 5% discount and 3 months upgrade to the next bouquet. Antenna decoder plus 1 month of premium bouquet at 34,000 shillings. Get yourself a StarTimes satellite decoder plus 1 month of premium bouquet at 40,000 shillings. The best Christmas offer only on StarTimes. Merry Christmas moment from StarTimes.
West Nile TV, lighting up the region.
The new year is you, the goals depends on you, and success falls on you. Good evening, dear viewers. Welcome to the NILECAST on West Nile Television. Today is Thursday, 8th of January, 2026. I am Pony Fiona. Let's first head to the headlines.
In the headlines tonight, Arua City voter locator slip issuance drives transparency in the 2026 Uganda general elections. A modern pharmacy and private wing commissioned at St. Luke Hospital, Angal. And stakeholders urged to address the health sector understaffing caused by funding challenges in Ajmani district. This and more in the NILECAST News Bulletin.
The Electoral Commission Office is intensifying efforts to ensure smooth 2026 general elections of Uganda with a voter education campaign focusing on voter locator slips and the voting process. Citizens are urged to check their voting details physically or online to know their voting stations and participate peacefully. Let's see the news in details. The Electoral Commission Office is intensifying efforts to ensure smooth general elections with a voter education campaign focusing on voter locator slips and the voting process. Mr. Ezela Usman, the returning officer for Arua City, in an interview with West Nile TV at the Electoral Commission Office on 7th January 2026, states that voters' locator slips are already on issuance by their supervisors at parish levels in wards in the city. The returning officer explains that voter locator slips are given to all citizens showing the parish location and stations where they will vote, and those who can't reach the parishes or wards can check them online. He added that the voter locator slip is a guide and you can vote with or without it, provided you are in the register and have an ID.
I'm called Ezala Osma. the returning officer, Arua City. We are issuing what we call voter locator slips. And these voter locator slips are given to people who are registered voters. And registered voters are all entitled to have that slip. So long as your name is in the register, you have a slip there. And we are issuing them. They are given to our supervisors at the parish level, and they issue them at the ward level for city. There are no specific documents required for collecting those slips. What you need is to go there and say that I am a resident of this place, I vote in this polling station. Or if you vote, like let's say in Mvara ward, you can go there, I've come to check on my voter locator slip. Then they'll ask you what is your name, which polling station you vote from, and all the polling stations. Actually, the register itself is what is called voter locator slips. It is your identity, your voter number, and the barcode that is attached to you. In case it is scanned, it brings your images. Those are what is called the voter locator slip. They are arranged according to the polling station. So once that polling station is there, that the registers are there, and that voter locator slips are there. Voter cards are distributed to all, not the citizens, but all voters. So long as you are voters, of course, you know, for you to be a voter, you must be a citizen of Uganda and 18 years and above. You must have originated from that place where they are distributing, or you're a resident there. Where you choose to vote is where those polling stations, where you get those cards. Yes, if you don't have that slip, it doesn't show anything that you cannot vote. Still, you can use a link that can give you where you vote from. Like the people who have computers or smartphones, you can click the link of Electoral Commission www.ec.or.ug. That one will take you to a series of things there, that web, but among them is the voter locator. Voter locator will, if you click your name, it will tell you where you are voting from. So some people have been using that to access the information. Every voter cards are there. So long as you are registered, those cards are produced in accordance with the register. So actually it is the register itself which is there, and the slips are got from the register. So once you go there, you can get those slips. And the slips are supposed to be given to individual. You take your own slip and sign for it. They are not, like, we don't demand anything, Commission doesn't demand anything, but demand your signature to ensure that, for accountability, that you have picked your slip. And I want to put it here, even if you don't pick those slips will be there at polling stations. You can get them there. If they are not there, still you can vote, so long as your name is on the register. These slips are just to aid the voting process, to aid the quickening of the voting process.
Mr. Ezala Osman also asked the people of Arua City to follow and obey the polling rules and guidelines on the election day to ensure peaceful participation.
Arua City is just a special appeal that when the countdown, we are coming to the end of campaigns, which after campaigns, which will end on 13th, we shall be going for polling. Polling is the voting day. And that voting day is a critical time in the Electoral Commission calendar. It is the thing that people value, that the election is successful or not successful. We have been doing a lot of electoral processes to arrive at this juncture, but at the polling day, if people come in big numbers to vote peacefully, that will say that we shall say as Commission that it's a success. And my appeal is also let's obey the rules. There are rules that are there. Even polling has guidelines. The guidelines among the things of polling is it will start at 7 and closes at 4 p.m. 7 a.m. starting point, closing point is 4 p.m. So in between here, please come and vote. Don't wait at the last minute. You will be rushing there, but when it clocks 4 and the 4 gets you not in line, you will not be allowed to vote.
Citizens are urged to check their voter details physically or online to know their voting stations before the election dates and participate peacefully. Reporting for West Nile TV, Pony Fiona, NILECAST. St. Luke Hospital, Anga, located in Nebi District, has commissioned a modern pharmacy and private wing, enhancing its healthcare services to the community. The new modern pharmacy and private hospital was commissioned by Right Reverend Dr. Constantine Rupino, Bishop of Nebi Catholic Diocese, costing over 800 million shillings with funding from donors. Alfred Jowok has more.
St. Luke Hospital, Anga, located in Nebi District, has commissioned a modern pharmacy and private wing, enhancing its healthcare services to the community. The hospital is a 220-bed facility offering general medical and surgical services, including specialized HIV/AIDS care. During the commissioning on 8th January 2026, Dr. Bernard Tugume, the Chief Executive Director, St. Luke Hospital, Angal, said the new facility will enhance proper storage of medical equipment as it is divided into 8 wards units with over 200 beds.
The Chief Executive Officer of Angal St. Luke Hospital. Today is a special day for the hospital and all its users because we will be commissioning a new building to store our medicines and other health supplies. It is very important because health supplies are core to the provision of quality service delivery. Previously, we had very little storage space. We were unable to store drugs worth 2 months. However, with this current increase in storage capacity, we will be able to store drugs worth 5 months of stock. And this will ensure availability of drugs, reduce stock out, efficient supply chain systems, and quality service delivery. I would like to thank all of you, the stakeholders, for the support you give to Angal St. Luke Hospital, especially the donors, Amichidi Angal and Regione Veneto, who gave us the finances for us to be able to realize this wonderful project. Thank you all.
Kalonzo Pimondo Emi, Chairperson Finance Committee, St. Luke Hospital, Angal, noted that the new modern facility and private wing will focus on reducing nutrition-related diseases and death for treatment of musculoskeletal conditions, stroke, and other neurologic conditions.
About this project here, the new pharmacy, it will help us a lot, because previously we didn't have enough storage facility where some drugs were being stored in the containers, and you know the temperature in the containers were not conducive for the drug storage. So this building is a modern pharmacy with all the facilities and the fittings. It's going to add a lot to the safety of our drugs and reduce the drug wastage due to harsh weather and so on. So it is a very, very good project which is going to help the hospital a lot. Yeah.
St. Luke Hospital, Angal, offers general laboratory tests, X-rays, ultrasound, and ECG tests. The new modern pharmacy and private hospital was commissioned by Right Reverend Dr. Constantine Rupin, Bishop of Nebi Catholic Diocese, and it cost over 800 million shillings with the funding from donors. The hospital is accredited by the Uganda Catholic Medical Bureau and serves patients from Greater Nebi districts and neighboring areas like Bolisa, DR Congo, among others. Alfred Jowok, West Nile TV, NILECAST.
Adjumani District Local Government Health Sector convened a second meeting with Medical Team International, the United Nations High Commission for Refugees, together with the Office of the Prime Minister, to ascertain mitigation measures to recruit the health personnel who had been laid off duties following funding challenges from major donors. 45 health personnel have been deployed as more measures to mitigate the crisis, and more interventions are said to be handled by development partners. Unzimai Alan has more.
Ajamani District Local Government Health Sector convened a second meeting with the Medical Team International and the United Nations High Commission for Refugees, together with the Office of the Prime Minister, to ascertain mitigation strategies to recruit health personnel who had been let go of their duties following funding challenges from major donors. During the meeting on the 7th of January 2026 at Ajamani District Local Government Headquarters, Honorable Anyama Ben, the LC5 chairman, called for an emergency response from the two parties on issues of staffing, quoting that 45 staffs cannot do the work of 245 staffs, and appealed for the readjustment of the recruiting docket of the Medical Team International.
It's not a simple matter. It's a very, very difficult situation we're in. Secondly, my position as district chairman still stands also on the matter of repatriation of refugees in case we fail to provide services. Because it will be hard for me to explain to the people of Ajamani when the refugees rise up and now beating people and chasing us away from our own land to Moyo or Boli, just because we have failed Sarah and the partners have failed their duty.
Dr. Drameto Dominic, the District Health Officer at Ajamani District Local Government, stated that the recruitment of medical staff will be carried out and a reorientation of health workers to cope with the challenges being faced in the health sector.
How will we spearhead that as a short-term solution? We're going to increase the health workers. We need to reorient their minds to cope with what is facing us. We shall need to do task shifting, long shifts. We shall have to work long shifts. We will continue to integrate services. We should be ready to do multiple tasks. We had this problem before, Chairman, you are aware, in 2008, after repatriation, the number of doctors reduced in the hospital. When I came back in 2005, we were 6. A time came when I remained alone for almost 2 years. But I had to use some of the clinical officers. Paul is here, Alex. I shifted some tasks to them. They will do ward rounds on medical ward, pediatric ward, as I concentrate where the emergencies on maternity ward and surgical ward. We need to also do this for now as the other processes.
Dr. Nyashanga Christopher, an in charge of the Medical Team International, stated that they have agreed to deploy 45 health personnel for the meantime as more measures are being handled by United Nations High Commission for Refugees.
Staff to 7 health facilities in the settlement. In addition to the 7 settlement facilities, we also have Numanzi Reception Center and Elego collection point. So those are 2 additional sites where we have deployed staff. So in total, 9 sites where we have deployed the 45 staff. To begin with, Numanzi, we have deployed 9 personnel, 2 midwives, 2 nurses, 1 clinical officer, 1 health assistant, 1 male assistant, and 1 cleaner and 1 driver. So there is 1 ambulance station in Numanzi Health Center 3.
Bernard Inkum, the head of the sub-office of the United Nations High Commission for Refugees Ajamani office, stated that once the funding is flexible, major challenges will be optimized, and as UNHCR programs, Ajamani will be prioritized since it's a major settlement of refugees in northern region.
The $1 million we had allocated for health services had to be allocated to the southwest and basically for Congolese refugees in that region. What UNHCR is doing right now is appealing to donors to be flexible in their funding. Once the funding is flexible, we are able to, because we know the needs and where they are. And so when the funding is flexible, we are able to allocate it appropriately to locations that have the needs. That's one way we are dealing with the current crisis.
The fate of the healthcare services in Adjumani district remains uncertain as the district awaits a decision to recruit health workers. The outcome of the decision between the Adjumani district local government and the medical team international will have a significant implications for the service delivery of essential health services. Reporting for West Nile Television, Onzima Alan, Okumaringa Christine, NILECAST.
Reverend William Maditroth has been consecrated as the new supervisor of Pakwach District Full Gospel Churches of Uganda. The consecration ceremony is a significant event for the Full Gospel Churches of Uganda in Pakwach District. Alfred Joe has more.
Reverend William Maditroth has been consecrated as the new supervisor of Pakwach District Full Gospel Churches of Uganda during the consecration held today, 7th January 2026, at the Full Gospel Churches of Uganda. Reverend Fred Wantate, National Supervisor, Full Gospel Churches of Uganda, said this marks the beginning of evangelical ministry and is expected to foster the spirit of synodality, promoting collaboration and shared responsibility among the Christians.
And now we are in a season of appointment of new leadership in different regions. The Full Gospel Churches of Uganda has got 40 regions in this country, and Pakwach region is one of them. And we have got an opportunity to appoint new leadership in the region that are going to serve the Lord in a new way. A younger generation that will do the work of the Lord in a new way, according to the current generation, but not leaving the old generation behind.
While addressing the congregations after his consecration, Reverend William Maditroth pledged to work together with all the Christians in the district and expressed his commitment to building a shared vision for evangelization and growth and to working collaboratively with the people of God in Pakwach district.
People. From the time you gave me leadership, I belong to everybody and I go everywhere. I don't even rate people or scorn people depending on their religion. I don't segregate. We shall work in unity. We will work in unity, business community, collaborate with the government, culture, business community, the cultural. All we will belong everywhere for the glory of God.
Meanwhile, Okwai Dennis Jawoko, Deputy RCC Arua City, advised the newly consecrated supervisor to work together with the government to bring change in the district.
Not allow politics to divide us. Let us not bring our politics in the church. For me, I want to thank God that you have endeavored to come as a witness or as witnesses to this occasion of today. Therefore, like you have come, you see into it that you pray for him so that his leadership stands strong.
However, Subuga Stephen Bewayo, Pakwach Resident District Commissioner, noted that this is a milestone which other religious leaders should embrace and take it as a legacy.
That this is the second time I'm presiding over a consecration of a full gospel bishop. As guest of honor. So my colleague deputy RDC. Deputy RDC. That time I got blessings. And there is no way I can move away from here without getting blessings from the new bishop. I won't thank Madam.
The consecration ceremony is a significant event for Full Gospel Churches of Uganda in Pakwach District, and Reverend Maditrot William is expected to provide spiritual guidance and leadership to his believers. Full Gospel Churches of Uganda, especially in Pakwach District, has over 125 churches established in various communities in the district. Alfred Jawok, West Nile TV, NILECAST.
Village health teams in Gulu City have raised concerns over low facilitation and inadequate supply of protective gears from the government. While interacting with the Gulu East Member of Parliament, Father Charles Onen, the VHT urged him to present their petition on the floor of Parliament to enable government properly budget for them in the next financial year. Stephen Okello has more.
In every cell or village in Uganda, there is usually one trusted person the community turns on when a child falls sick. Despite being the first point of contact and the high of the health center 2, 3, and 4 facilities at grassroots, the VHTs says government has continued neglect their welfare.
Division kind, ini American wa no ngate ne we no we ni VHT ting bad. Pe no teacher wa chala wan wa 2P, wan wa dier me teach. Me gu yeni wan wa dier ma chul mo pe. Che di dare ka libario ma mai ti mi ngan ma nu o me fo teacher e ni deo I chamo e no be. I wa pe yom.
They further demand the provisions of adequate protective gears such as branded aprons and identification tag to ease their work within the communities.
Transport. Mio kawachero kamongene.
The area member of parliament for Pachilaro City Division in Gulu East, Father Charles Onen, acknowledged the challenges faced by the VHTs. He not only pledged to present their concern in Parliament, but also promised to establish a dedicated desk in his office to handle VHT and other community health-related issues.
We tasked, or Parliament tasked the Ministry of Health, one, to get some money as an appreciation token or an ex gracias to be given to the referrals, to the first referrals in our society. What the VHTs are doing are quite enormous. We cannot underestimate their contribution. The main hospital or the major referral hospitals in Uganda, they first receive first-hand information from the village health team.
Meanwhile, Gulu City Mayor Alfred Okwa applauded government for leveling the supply of drugs and medicines in public health facilities, saying the move has helped curb drug thefts at the grassroots level.
And by leveling all the medicine coming and supplies coming from government with the stamp of government of Uganda, that one was a good initiative.
In response to the concern raised by the grassroots health workers, often referred to as Health Center 1, at village and cell level, the leaders promised to prioritize issues of low facilitations for VHT in the next financial years. Stephen Okello for West Nile Television, NILECAST.
We have come to the end of NILECAST on West Nile TV, and as the health news surrounds our news leads of today, it is our responsibilities to prioritize our health as the government and the local leaders plus the other donors work hard to ensure that the health facilities work. Thank you for always viewing us on YouTube, StarTimes, Azam, and Zuku TV. I remain Ponifiona. Thank you for watching. Good night.
West Nile TV, lighting up the region.